Let's stay in the Eastern Cape now, where we're joined via Skype by the Eastern Cape Health Department Superintendent General, Dr. Thobile Mbengashe. Dr. Mbengashe, very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening to you as well.
So much has been said about the Eastern Cape Health Department's readiness to contain the spread of COVID-19. Where is the department now in terms of the containment measures?
We're fairly advanced, and we really have readied our work in terms of the current capacities, contingent capacities, critical capacities, and the surge capacities. So what we really done was that we needed to make sure that the lockdown interventions give us sufficient space to build the healthcare services to be responsive. And what we did then was to make sure that we are building new capacities to provide critical care services. We're going to add another 300 facilities for ICU. We also understood that there's going to be a lot of sick patients which are severely ill and would need hospitalization. And therefore, we repurposed around about 1,000, 2,000 beds for really COVID purposes that will be separated from the ordinary hospitals. And then we're building what we call field hospitals to manage the isolation of COVID positive patients. Those we think are going to be important as a mitigating strategy against the screening, testing, and isolation, which we're targeting individuals, trace them, everyone who's been infected, and also target what we call cluster infections within communities, establishment, and the big transmission areas.
Well, Dr. Mbengashe will touch on the testing and the screening issue in just a moment. But the department has been lamenting the fact, the facts surrounding the poor adherence to the lockdown regulations. So what could possibly necessitate the non-adherence to the lockdown regulations? Could it be triggered by the social or economic issues?
I think there are literally three big areas. One, obviously, this has been a very rapid transition to actually achieve a high compact social behavior. And I think the stress in communities has also created its own dynamics. It's very interesting that we saw a number of people who just came through our borders because there have been opening of the post-level 5 lockdown. And this has really created a huge influx of individuals. The second problem, obviously, is really the social grants, where rural communities have to come to town to collect their grants and make their groceries. And the third area is that people have just not been as responsive as they are. What we have found as a reason for this is that, we saw this during the HIV and AIDS. It takes time for people to really realize the gravity of the situation. Because they were not seeing anyone dying, because everyone was kind of having a mild diseases, there is a sense of alarm that this is not as bad as people are trying to say. So we think that more is being done anyway. I think the change in behavior of people wearing masks is a very important contribution. And I think the fact that people now understand that washing hands is important. We're not succeeding in the social distancing. We still have a lot of cluster of people being together, but we also understand that people are accepting the testing and they are accepting the isolation as well, which is a good thing.
Well, Dr. Mbengashe, we understand that the national COVID-19 testing backlog means that patients have to wait up to 10 days to receive results. And in the past week, we've seen people going back to work, as part of the easing of the level 5 restrictions, and only to find that they have the virus after returning to work. So have the testing protocols been strengthened in that province?
Yes, I think this is very important because if you look, we have actually screened just about 960,000 people, and we've tested over 25,000 people, which gave us the numbers of the over 1,000 people that we have. That level of testing is a very high level of ramping up testing. What then has happened is that the laboratory services, because of the huge demand for testing, is also constrained by, one, the availability of the reagent, and two, that there's still a not international demand for these. We have about 4,000 backlogs of the tests that needs to be done. What is important to our communities and to everyone is the fact that, one, we just need to make sure that the measures to stop the transmission wearing a mask so that you protect the next person, washing your hands and don't touch your eyes, don't touch your nose, and don't touch your mouth is the second one, and making sure that you are limiting the number of people within your areas. In the workplace, what we're really pushing for is that, one, people who come to the workplace must have their hands and the hygiene being done, and then sanitizers. 2, decontaminating of surfaces. And then 3, everyone really wearing a mask will go a long way. But we also want to make sure that we're creating a strong surveillance system, that anyone who's feeling not well, who's got a flu, must stay at home. And secondly, that we should continually have a number of people now within the workplace that are continually allowing and checking whether people have symptoms. Once you find symptoms, then you have to be referred to health services where we can screen and test you and isolate you. We think that we have to balance what is called the public health intervention, which has made a huge difference in making the curve not to rise as fast as it can. But that has to also give a little bit of space to the social requirements of people having a little bit of movement, but also we want to recover the economy as well. So it is going to be a balancing act. We think we're going to see more bigger numbers than we have, but we've created enough capacity to respond than before when the epidemic started.
Well, a tough balancing act, you say, between the constraints that the department is facing in terms of capacity of testing. But then I guess the crux of my question, Dr. Mbengashe, is how do we then shorten the waiting period for test results so that people know their status and so that they can protect those around them?
Yeah, and I think, what has been very useful is that the minister, together with national laboratories, have really expanded their capacities. We're getting new machines. We've got about 11 mobile facilities. There are opportunities now to bring some of the rapid tests, and we are really trying to streamline our testing system. We think we can get more in terms of following someone who's been COVID positive and making sure that the networks of those individuals are traced and actually to actually screen and test it. We think we will improve the yield. Remember, we were starting the process and we're really being very anxious to provide and get as many people tested. But we've found with our results that when we target our focus and make sure that we're following the trail of the contacts and testing those. In larger communities, we find that if there's an epidemic, we follow the tracing and contain those. That's going to give a much more relieved pressure to the National Laboratory Services. At the same time, we will not lose in terms of finding the people who need to be isolated from communities. And as the markets for reagents and tests are relaxed, we're going to get more tests. We need to test in order to isolate and give post-lockdown period a best chance to survive, and making sure that our health system is not overloaded.
Now, Doctor, there is even more depressing and I would say quite disappointing news coming out of the Eastern Cape Health Department, and we understand there's been an outbreak of the African swine flu. Can you confirm that, and can you confirm that the Eastern Cape Health Department is now ready to contain the African swine flu?
Yes, there is an outbreak of the swine flu, but this is an animal disease and is actually managed through our rural and agricultural services. It's not the same swine flu which affected human beings. This is really contains to the pigs. There is what is called a zoonotic diseases where you have a jump of a virus from the swine into a human beings, but this is not the case. So what is then happening that our colleagues at the agriculture are really dealing with these. They're doing a very similar thing like we're doing. They've got a testing system that goes up to find the sick animals, and those that needs to be put down, they are put down, but it is not really related to the problem that we have. What we are worried about is the flu, which is the ordinary flu, and we are targeting elderly people. We are targeting our healthcare professionals. We're going to vaccinate those over 60 with comorbidities. We also want to provide our healthcare professionals with a priority vaccination against flu, so that our health professionals, together with the PPEs, are actually protected from infections, and they continue to provide and support us as we become ill or when we need some support from healthcare services.
All right, Dr. Thobile Mbengashe, thank you so much for your time. We appreciate your time.